Welcome everyone to today's session of our NOW program educational webinars. Today's topic will be mental health. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to the NOW team for this continued partnership. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat and Q&A feature throughout the session. At the end of the session, your questions in the chat will be used to moderate a Q&A. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website, www.dana-farber.org/resource center, or email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I will now pass the workshop over to our speakers.
Welcome to a new Neuro-Oncology Wellness educational webinar. The Neuro-Oncology Wellness, or NOW program, is an initiative from the Center for Neuro-Oncology at the Dana-Farber Cancer Institute, with a mission to educate patients and their caregivers about brain tumors, as well as provide resources to promote overall health and well-being. My name is Rachel Garcia-Fox. I serve as the program administrator for NOW, and I will be your host for this webinar. Today, I am joined by Dr. Damian Myron and clinical social worker Benjamin Pierce for a discussion on mental health in brain tumor patients. Dr. Myron is a psychiatrist at Dana-Farber and serves as the clinical director for Dana-Farber's inpatient psychiatry consult team, and associate director for the neuro-oncology program, the GROW Support Program. His clinical and research interests include the psychiatric care of patients with cancer, neuropsychiatric symptoms related to cancer, and cancer treatments and demoralization in individuals living with cancer. He completed psychiatry fellowship training at Dana-Farber Cancer Institute, Harvard Medical School, and Brigham and Women's Hospital, and completed psychiatry residency training with the Harvard Longwood Psychiatry Residency Training Program, training primarily at Brigham and Women's Hospital and Beth Israel Deaconess Medical Center. Benjamin Pierce is a licensed independent clinical social worker who has been providing clinical mental health care to brain tumor patients in the Center for Neuro-Oncology at the Dana-Farber Cancer Institute for 5 years. He received his training at Simmons and completed his undergraduate education at Tufts University. Ben also runs the Brain Tumor Support Group alongside one of the Center for Neuro-Oncology nurses and is a member of the multidisciplinary team of the GROW Support Program in the Center for Neuro-Oncology. Dr. Myron and Ben, thank you so much for joining us today.
Thank you for having us.
Yeah, thanks so much for having us.
Before we get started, I just want to remind our live audience here that we want you to be a part of this conversation by submitting your questions via the Q&A feature at the bottom of your Zoom screen. We will select a number of your questions for our guests to answer in the second half of the program. So let's go ahead and get started. Dr. Myron, we'd like to start off with you. Can you tell us, so we can all get on the same page, what is mental health?
Definitely, yeah, and definitely thanks again for having us. We really appreciate having the time and space to talk more about mental health care. Mental health can be a broad term, and it can be used differently by different people and have different definitions, but fundamentally, mental health refers to our emotional and psychological well-being. Just like physical health, mental health is an important part of a person's overall health, or what we call their whole health. There are a lot of factors that can impact our mental health and are also impacted by how our mental health is from day to day. When most people think about mental health, they're thinking about emotional experiences, including both positive emotions like happiness or pride, and also potentially negative emotions like fear, sadness, or guilt. And our mental health impacts the emotions that we experience day to day, our behaviors, how we react to stress or stressful events, and how we manage and thrive in our relationships. So it's definitely an important topic to consider, whether you're going through cancer treatment or just for anybody going through life.
Thank you so much for that overview, Dr. Myron. Ben, you've been working with brain tumor patients now for 5 years, providing counseling and individual therapy. So you have a lot of experience. What are the areas that you see most impacted by brain tumor diagnosis?
Sure. Certainly everybody's story is different, but there are a lot of similarities in what at least the start of treatment looks like for patients in this clinic. Soon after a brain tumor diagnosis, most patients are quickly admitted into a hospital for tests, scans, and surgery, all on the part of their body which helps them absorb information, process emotions, and make decisions. And so that can be a very hazy, confusing, and I would say traumatic time for patients, especially when they are trying to learn about their illness and their treatment plan, while also recovering from the physical and emotional stress of surgery. In short, it's a physically exhausting and emotionally overwhelming time, which can result in a flood of powerful emotions. Routines are often interrupted, rearranged, or completely changed as patients prepare for treatment and adapt to appointment schedules. And with these changes comes uncertainty, and uncertainty can make it difficult for patients to feel confident about the future because the plan might be evolving, and there isn't an adequate amount of time to really give everything its emotional due before you're getting hit with another piece of information or a wave of emotions or thoughts. So people can feel very maxed out very quickly. And additionally, patients with a brain tumor diagnosis can experience different kinds of symptoms. On the physical side, there can be an impact on their capacity to complete activities of daily living. We call these ADLs, and that can include taking care of yourself, feeding yourself, clothing yourself. It can affect mobility and your sense of independence, and this can lead to a greater reliance on others for help, which others are often happy to give, but still this can impact our self-esteem. And additionally, there are sometimes cognitive symptoms which can impact communication, memory, concentration, and through different combinations of these symptoms, sometimes there's a resulting frustration or confusion or just distress. I like to say that with a brain tumor diagnosis, there's a lot to say, and it's especially hard to say it. So it can that's a bit of an overview, at least at the beginning, I would say, of how this kind of diagnosis tends to affect people to different degrees.
Thank you, Ben, so much for that overview. It was very thorough, and you're right, it is a multifaceted experience. We hear the words anxiety and depression a lot when we're talking about mental health. I'm wondering if we can go into a little bit more kind of what exactly anxiety and depression are. I'm wondering, Dr. Myron, if you could give us a bit of an overview. And then also kind of explain to us, do we only see these conditions in brain tumor patients?
Sure, yeah. So when we think about anxiety and depression, more in like a psychiatric terms, we're thinking about when someone's experience of either sadness or worrying or hopeless feelings that people might have at any point, anybody might have day to day. They might have a time where they're feeling sad or down about something, like if they got bad news in some way, they might feel sad about it, but bounce back like a lot of us do. But when people are experiencing more more severe symptoms of anxiety or depression, or more like longer lasting symptoms, that's when we start to worry, or we might call it like an anxiety disorder or clinical depression or clinical anxiety. With depression, we think about sadness, like feeling low or just feeling down or feeling blue. Other things that can come with that are losing interest in things that people used to do for fun, like their hobbies. Or maybe there's somebody who like to spend time with friends or family, but they're just not as into it anymore, not wanting to do those things, or not getting joy out of it when they do participate in anything that they used to like visiting with friends or family. And other things like feeling less motivation, feeling guilty about something, whether or not maybe there's merit to having a feeling of guilt. But even if there's something that you might feel guilty about in another situation, it might be more, intense or harder to shake off. And with anxiety, it's worrying about something that maybe you wouldn't have worried about in another context, or just having a lot more worries, or the worries don't go away with time like they might have done in the past. For more severe symptoms of anxiety, we think of things like panic attacks, where you have physical symptoms that come with the anxiety. So you suddenly get like a spike of anxiety, and then you might feel short of breath, or you feel like your heart is racing, get sort of flushed or sweaty. That could come like with more severe forms of anxiety. Anybody can have symptoms of depression or anxiety, whether or not they would meet the full criteria for what we might call like a clinical depression or clinical anxiety. But unfortunately, we do know it is more common in patients who have brain tumors for a lot of reasons. One, there's the stress of having the diagnosis and going through treatments. There's some brain cancer treatments can cause anxiety or can make people feel more tired or worn out, which might contribute more to depression. And there's also sometimes where, depending on where the cancer itself is in the brain, those might more directly cause anxiety or depression or similar symptoms too. So unfortunately, it is more common, but we still try to explore like what each individual patient is going through with their symptoms, and think through like what's life for them like with this diagnosis.
Thank you. That's very helpful. Ben, is it inevitable that brain tumor patients experience anxiety and depression?
Oh, of course, everyone's experience is unique, and no one experience is exactly like the other. But I think it's generally safe to assume that a majority of patients in our clinic will experience depressive symptoms or anxiety symptoms. And I think that this is a reasonable reaction to what is often a chronic and life-changing illness. Patients are worried or sad because their health is important and it's worth stressing over. As Dr. Moran put it, we want to emphasize that while many patients will experience anxiety or depressive symptoms on some level, that doesn't mean that they automatically receive diagnoses of clinical anxiety or depression, which is a formal diagnosis of depression or anxiety, which requires specific criteria observed over time. But I would say that in my experience, no matter what their specific diagnosis is, many patients go through a kind of grieving process, but instead of grieving for a person, they're grieving for the life that they had prior to diagnosis, when they didn't have to make room for this condition in their personal plans or even their day-to-day lives. And although grief is an uncomfortable experience for patients and families, it's also usually a necessary piece of the healing process, and denying or suppressing those feelings will only kind of delay progress in healing. And it can make people feel emotionally isolated by the uncomfortable thoughts that they aren't sharing with other people. So sometimes, like, the grieving process is the only way through. But we don't like to pathologize anxiety or depression in this clinic, because there's context for why they might be feeling this way, and we certainly don't want anybody to feel these symptoms. But I think that we can empathize with, in some ways, it can feel unavoidable to experience them on some levels. Our main concern is just making sure that they don't get in the way of functioning outside of the clinic and impacting their quality of life more than it has to.
And it sounds like talking about the feelings is a big part of that, of accepting them and maybe kind of moving through them. Thank you for that. And Dr. Myron said too, every patient is different. So, these things may come up for someone and be really difficult and take time and treatment to get through. And for someone else, it could be something that is maybe a quicker process, but everybody's different. And we've talked mostly about patients so far. I'm wondering, because caregivers, as we know, play such an important role in the lives of our patients in this clinic. Dr. Myron, how do you recognize if a caregiver or a loved one is depressed?
I think it's a great question. And I think it's similar to how you might think about it for someone living with cancer. Just this similar symptoms still apply. So I think checking in with them is usually like the first place to go, just like asking them like how they're doing, knowing that they've been going through a stressful time, and just seeing kind of how it has been for them coping with that. I think unfortunately caregivers can often feel neglect is probably not the right word, but I think they go through a lot that is not always seen by others, even others in the same family or by providers. Like even at Dana-Farber, I think we're more likely to be aware of that at Dana-Farber. But I think even still, there's a lot that caregivers do that goes unseen. So I think kind of bringing it into the open and just checking in with them, I think could be the most important thing. We're always thinking about the same sort of symptoms, like are they withdrawing from their friends or from their family more? Are they less likely to engage in their hobbies or things that they enjoy? I think taking that with a grain of salt too, knowing that if they are spending a lot of time caregiving for their loved one, they probably are going to be less likely to be able to spend time in those hobbies that they had before, which is a sacrifice. So it can be a little tough to say, like, oh, are you doing less than you used to do? The answer almost always is like yes, because I just don't have the time. But still checking in and saying like, oh, when you do have time to do those things, like, are you still enjoying them, or is the stress, the depression, anxiety preventing you from getting joy out of those things?
That's great advice. Thank you. It sounds like just being curious is kind of a way of supporting someone, just asking someone, what's going
Yeah.
on to understand it best. But thank you for also clarifying kind of some of those symptoms, withdrawn, maybe lower energy, et cetera. So before we move on to kind of thinking more about how we support people and provide treatment, I'm hoping to just remind the audience that we have the Q&A in the chat here at the bottom of the screen. And we just want to encourage you to put any of your questions now into the chat so that we can get to them at the end of the question portion of this. So moving on now to think a little bit more about mental health care and treatment. Ben, what do you find, and this is a tough question, I know, is the most effective support for brain tumor patients dealing with mental health?
Well, there are a lot of different treatment modalities that guide thinking around how we support patients who are experiencing depression or anxiety. One that comes up a lot in this clinic, I would say, is cognitive behavioral therapy, or CBT, partly because there's a lot of research behind it, and partly because patients and providers often find it very practical. A couple core tenets of CBT include learning to recognize thoughts, feelings, sensations, and actions which trap us in negative cycles, breaking overwhelming feelings into smaller, less intimidating parts, structured techniques and exercises to address these stressors as they arise. And there's also a focus more on the present and progress toward personal goals and less on the past and kind of what got us here in the first place. It's a very kind of forward thinking, forward moving modality. And I don't think that any provider relies on just one treatment modality, but that I think that is often in the conversation when we are talking about different kinds of techniques that we use to support patients with anxiety or depression. At Dana-Farber, we endorse and offer group therapy for patients and caregivers, and they are available in most disease centers in Dana-Farber, including neurological cancers. Many patients find it helpful to connect with other people with firsthand knowledge of this illness who can truly empathize with their own experiences without having to be educated on the basics of this disease group. And group members can share experiences, trade information, offer encouragement, while a designated group leader facilitates the conversation and ensures that all attendees get space to participate. Another thing I would just say is that, like I said, there are many treatment modalities, art therapy, music therapy, narrative therapy, dialectical behavioral therapy, mindfulness techniques, et cetera. And I think what's most important is to find the one that engages you and which is offered by a person or group that you trust. You generally aren't going to be open, authentic, and invested with a provider or modality that you don't trust. So I think that's a piece where you want to listen to your gut and see if this feels like a good fit for you. It's not a one size fits all kind of situation. And we meet people with different experiences with counseling and different impressions of it, and we try to meet people where they're at. So I think that, to kind of sum it up, the best thing you can do to support someone with anxiety or depression is to be available to listen, to not deny it or invalidate it in any way, and just be receptive to supporting them or connecting them with the resources that they need. So those are my thoughts on that.
Wonderful. Thank you so much, Ben. Really helpful to hear. Sounds like there are a lot of different ways to approach depression and anxiety, and that, CBT is cognitive behavioral therapy, as you said, is one of the more popular choices right now. But I love what you said, that, it's kind of not one size fits all. It's going to depend on you and what works best for you. Every individual, will respond to different modalities in a different way.
Right, and providers will often draw from a few different kinds, or they'll cherry pick the pieces that work best, for them,
Yeah.
or their own style. So you're usually getting no provider here is generally like a CBT only therapist. I
Right.
think that there's a well of information to draw from, but CBT forms the backbone of a lot of treatment approaches, I would say.
Yeah, and I think also, if you are interested in understanding like therapeutic modalities, behavioral therapy modalities, and you do see a provider, it doesn't hurt to ask them, what kind of modality are you thinking about, to treat me, or what modalities do you draw from? And it sounds like most people will have, everybody will have a different answer probably on the therapist side of things. Dr. Myron, correct me if I'm wrong, but I think, the recommendation typically is that you receive treatment for depression and anxiety, both in a therapeutic talk therapy setting and also with a pharmaceutical intervention, that those two things go hand in hand really well. I'm hoping you can tell us a little bit about the pharmaceutical interventions.
Definitely, yeah. So I think you're right. We would usually recommend a combination. If we were going to use medications, we would recommend a combination of medications and also therapy, whatever modality that might be, whatever fits best for that patient. But when we think about medications, I usually start by talking with patients about getting or asking a little bit more about what are the specific symptoms they have, because not everyone's anxiety or not everyone's depression are the same. Some people have really bad insomnia with their depression, where they're sleeping, they're not getting enough sleep, they can't fall asleep at night. Some people are the opposite, where they're sleeping more than they usually would. So obviously our medication approach might be a little bit differently for those two patients. So we try to get to that first. What are the symptoms you're dealing with? How often do you have them? Is there any correlation with when you're getting treatments at Dana-Farber, other stressful things going on in your life? So just get a better sense of, the person, the individual and what they're going through. When it is time to start a medication, we would think about, is someone's anxiety, depression to the point that they need an everyday medicine to keep the anxiety or depressive symptoms away across the board, or keep them down across the board, or more something like you get anxiety here and there, once a month, every other weekend. An as needed medicine is better, that you just take it when you need to, and you don't have to take an everyday medicine. For folks who do need an everyday medicine, and that happens a lot, where people do need something to help control anxiety or help decrease their depressive symptoms, there are antidepressant medications, different families or groups of medications. The ones we think of first are what we would call like first line medications, are called SSRIs, or selective serotonin reuptake inhibitors. There's a lot of different medications within the family of SSRIs. Common brand names that people may have heard of or seen on TV are things like Prozac, Zoloft, Celexa, Lexapro. There's lots of different options, and really it's best to talk with your prescriber, whether that's a psychiatrist or primary care doctor, nurse practitioner, whoever it might be, to talk with them about what are the symptoms you're going through and what might be the best fit for you. Some people have had bad experiences with antidepressants in the past, or know people who had bad experiences. When that happens, I usually ask them ask the patient, what was the medication you were taking? Was it a long time ago, and maybe that medication's not used as much anymore because newer ones are coming out, periodically. So I think it's really a discussion of what are you going through and what would be the best match for you. Not everyone finds help with the first medication that they try, but there are other options we could try. And the point is to try to make sure that if you're going to be taking medication, you want it to be as helpful as possible and have the least amount of side effects. So SSRIs are the first class. There's other ones like SNRIs, TCAs. There's lots of different options. And if there's one that, if you've had bad experiences before, I'd say you could try a different medication or a different approach to it. So there's lots of different ideas.
Thank you so much, Dr. Myron. Sounds like, it's personalized medicine in mental health, too. We talk about personalized medicine a lot, when we're speaking about tumor treatment, anti-tumor treatment, but mental health is no different. It's going to be specific to your situation and, what you're dealing with. Circumstances like sleep, may impact what medication you're prescribed. So yeah, if anybody has been to our other webinars, we talk about personalized medicine a lot, and same applies here. So appreciate you explaining it a little bit more. We often see patients who try to help their anxiety symptoms by increasing alcohol consumption and also cannabis. Do you have any thoughts on this, Dr. Myron?
That's definitely true. A lot of people, whether they're going through cancer or cancer treatment or not, do drink alcohol or use cannabis products to help with anxiety. Or anxiety or depression. There's lots of reasons why people use things like alcohol or use different cannabis products. And people use them for different reasons at different times too. I would just say, I think, especially with things like alcohol, just being aware of your use. And if you're finding that you're using more and more, maybe it's a sign that you would be better off with like either a medication option to help with anxiety or talk therapy option, something else if the alcohol or the cannabis might be trying to treat, but maybe there's better ways of going about it. And I think being open with your cancer team and your physicians in general is always helpful, because there might be different consequences of using alcohol heavily or using cannabis products that might impact your cancer treatment, or you might be at more risk for certain side effects or certain consequences of cannabis or alcohol use, depending on your cancer type. For some people, they really can't smoke any plant products. That's less so for neuro-oncology patients, more for people who have really limited immune systems or are immunocompromised. But there's some things that just not everyone might think about or might draw a connection to. So it's always helpful to talk about it with your providers. I think there's always concern that the providers would potentially judge you, or it might impact your relationship with your provider. I think that's always a concern that people have when they're talking about potentially sensitive issues like this. I think it's helpful to kind of set the frame and talk with them about your concern. If there's someone else on your team that you feel more comfortable talking with, that could be helpful too, whether it's like your social worker or a nurse that you're working with, or nurse practitioner. It can be helpful to kind of talk with others about like what's a good way to approach this. But I think it's always better for your doctors to know more, just so they can kind of have a better sense of how best to treat you.
Yeah, thank you for bringing that up, Dr. Myron, that issue around communication. It's normal to feel maybe nervous about disclosing something like that. And still, it's really important to communicate with the team. So you can think about who is the best person to tell, who are you most comfortable telling? And I think that's really good advice to kind of think about that and to speak to the person who, you're most comfortable telling, just so they can make sure that, you're doing what's best for you. And, if you're on a clinical trial, which I know many of our patients are, sometimes alcohol or cannabis consumption, probably more cannabis, is actually, not allowed or not encouraged. And there may even be a reason for that. So always good to double check with your team. Ben, let's go over to you. So what do you recommend to a patient who thinks they might be depressed or struggling with anxiety? And let's say this is someone you haven't met yet. So, there's somebody that's being seen at Dana-Farber, for example. What do you recommend they do?
Some of this will piggyback on what Dr. Myron already introduced. So thanks for setting me up. But, first step, I think, to getting help is admitting to oneself that there might be a problem, or at least that things could be better. Unfortunately, some patients feel like there's still a stigma attached to a mental health diagnosis, which can make it scary to consider. I think there's a real kind of pull yourself up by your bootstraps kind of mentality in this country, and that's it's part of our history and it's part of our image, and it can make it feel like asking for help or seeking help is something that you should hide. And I think things have gotten a lot better in the past, century, but there's still room for improvement. If you feel like either depression or anxiety is becoming an intrusive part of your life, I would recommend exploring this possibility with someone you trust, whether it's a family member, a close friend, or a member of your medical team. You might find it easier to address the problem if it doesn't feel like a dirty secret. If you're a patient at Dana-Farber, you have options for support within the Department of Psychosocial Oncology, which is made up of psychologists, psychiatrists, palliative care clinicians, social workers, and other mental health specialists. Social workers like myself sometimes act as like a first line of mental health support for patients looking to explore these feelings and potential resources. We offer supportive counseling, provide referrals to providers within and outside Dana-Farber, and facilitate support groups. And when appropriate, we can connect patients with other members of the psychosocial oncology department so that they can access psychiatric medications, more advanced therapy modalities, spiritual care, palliative care for pain management, etc. So yeah, that would be if you're a patient at Dana-Farber, I feel like there's a good culture in the institute around connecting patients with psychosocial support. I think that there is a very low threshold for activating that resource, and I really am happy to work in a institute like this that really pushes that. I think that we have there's a lot of empathy in this clinic. And so if you're nervous about discussing it outside of Dana-Farber, I want to assure you that it's a safe space here.
Thank you, Ben. I agree. I think there is a lot of empathy and that help is usually not far. And, telling your clinic team is a great first step. And telling someone close to you is also a good step. But yeah, asking for help, it can be hard, but it's definitely like the first step to getting better or feeling better. Ben, sometimes our patients do struggle with getting access to services, and this may be because they, for some reason, don't qualify for services here, or they just aren't able to connect with the provider. I'm wondering if you have any recommendations for people to get care, psychosocial or behavioral health care, maybe that as outside of the psychosocial or psycho-oncology department.
Of course, yeah. And so a few places to start. I would begin with your PCP or other primary clinicians on your medical team, as they may have experience working with specific providers with relevant experience. So for example, if you're, asking, your pediatrician's office about your child, they might have a connection with child psychologists or child therapists. I think the same is often true here in the Institute. But it extends to offices outside of Dana-Farber. I would say, PCP is a good place to start. Your insurance provider will often have a database of mental health providers who accept your health insurance plan, and you can either try their website or call the number on your insurance card for more information. Usually, most insurance cards will have some sort of help number on the back. There are online search engines like Psychology Today. You might have seen their magazine at the grocery store, but they actually have a pretty robust search engine where you can search and filter mental health providers by area code, insurance, specialties, other criteria that might be important to you. And it also provides options for both in-person appointments and virtual sessions over Zoom, depending on your comfort level. I think ever since COVID became a part of our lives, we've really embraced virtual counseling. It's an adjustment for sure, and maybe that's not the kind of therapy environment you're looking for, but it also eliminates a lot of barriers to counseling, like not having to get transportation and being able to fit it into a busy schedule at home. There are also behavioral health centers in your community that will offer support for a wide range of mental health challenges, and they can conduct an assessment to match you with an appropriate provider within their team. You can find a list of Massachusetts area behavioral health centers on the mass.gov website. I can't believe I just butchered that word. So sorry. That's all I'll say before I make another flub.
No, that's great. Thank you, Ben. You mentioned a lot of really good resources. I'll just recap. I think you mentioned PCPs first, so primary care physician, great person to go to as a first step, because sometimes you might have a psychiatry department in the same office or same group, physician group as the doctor that you see for primary care. And oftentimes, a referral like that, an internal referral is easier than someone that, is in a totally different office that you've never been in before. And then you mentioned community behavioral health centers, I think, which mass.gov, you can search CBHC, I believe, and you can find a search engine database there. And then Psychology Today, which, like Ben said, there's maybe a magazine you've seen, and there's a database of tons of people. Your insurance company is the other thing. And then, I think all of these are really great resources. So thanks for bringing those up. Dr. Myra and Ben, thank you both so much for this very comprehensive discussion on mental health in brain tumor patients. I wanted to give you both an opportunity to tell us some take-home points that you'd like to leave with the audience.
Rachel, I was just going to say too, not to make a plug, but on the Dana-Farber website, there's a link to the social work department where there's a library of tip sheets that we've written. I'm a member of the team that helps write the tip sheets along with a bunch of our social workers in the department, and we've been in the process of updating and reviewing them. Rachel, I can share with you the link to that maybe, and you can, I'll send it to you, and you can maybe find the best way to disseminate it to the rest of the people on the chat.
That'd
but
be great.
I mention it only because I thought of it because one of the tip sheets that we're updating now, the original version is still online, but it's about how to find mental health care in the community. And there's a lot of different resources listed there that Ben mentioned, but there are links there too. So it might be a little bit easier. There's also tip sheets on anxiety, depression, coping with caregiver stress, spiritual care, things like that. So there's just more information that if interested, you could always find there. And we've been trying to update them and get them a little bit more fresh. They're not so old, but we're trying to update them anyway.
No, I'm really glad you mentioned them. Thank you. I put the link that you sent me in the chat for everybody who's joining us today, so you can access those resources that Dr. Myron just mentioned through the website.
You have to scroll down towards the bottom. It says tip sheets for patients, families, and caregivers. So they're down there at the bottom. And I don't think you have to be logged into anything, right, Rachel, to see those?
No, they should be public.
Right.
Correct. Yeah.
I would just say be patient with yourself and how you feel about your treatment experience. I meet a lot of patients who try to convince themselves that they should be feeling a certain way, or that they don't have the right to feel certain emotions because other patients are having a more difficult time than they are. And this just is very unfair to you. And you only know your own experience, and there's no benefit to pitting your own medical journey against someone else's. It's not a contest. And I really hate to see people be so hard on themselves while they're going through such an intense treatment experience. So I would just welcome people to kind of embrace and be open to whatever they're experiencing, and don't try to qualify it. Just know that this can feel like a very isolating experience and a very lonely experience, but what you're feeling, millions of others have felt some version of that. And I just hope that you know that you're not alone, and there are people happy to support you if you're open to giving them a chance.
Thank you, Ben. Those are some very kind words. Dr. Myron, do you have any take-home points? I know you mentioned the tip sheets. Anything else you wanted to mention before we move on to some questions from the audience?
I think I just say it never hurts to ask, if there's something that you're wondering about with your treatment, whether it's mental health or otherwise, it never hurts to ask your oncologists, the social workers, whoever else you're working with, because it might be, I think a lot of times we wonder things and or we're too afraid to ask for, any number of reasons. But sometimes there's an easy answer and it could make a big impact. So if there's a resource you're looking for, something that you've been trying to figure out on your own, sometimes it helps just to ask, because for a lot of those things, other people have asked that question and an answer has been found already. So you could always just ask and they could just give you the answer that somebody else has already worked hard to track down. So I think it never hurts.
It's a great point. Thank you both so much. We're going to answer some questions from our viewers now. We actually had a question come in over email beforehand that I wanted to start with. So this is a patient that's completed their treatment, so they're not on any active treatment, and they're on surveillance, just having MRIs at intervals. And this patient was wondering if you had any strategies for combating the daily stress of possible recurrence.
I think I'll take a stab at at this. That just encapsulates, one of the main stressors at the heart of this thing, is that you go through such an intense treatment experience, and there aren't always guarantees around what that's going to do for you. And recurrence is always, it's on the board as a possibility. And if you're working with us at Dana-Farber, you have a medical team that's likely keeping tabs on you and doing scans regularly, as appropriate, just to nip any changes in the bud and, roll with those changes. But it can be really hard to focus on anything else after you've gone through such an intense treatment experience, and then to try and just pick up where you left off, so to speak. I would say, one thing that I recommend is that you're going to feel that stress, that protective anxiety around your health, because you fought hard to reclaim it and to take care of it, and to nurture it. And it might not be reasonable to eliminate all anxiety around that. But I think it's okay to dedicate some space for you to feel those emotions and to process them, talk about them, reflect on them, maybe cry over them and mourn them, so that you give those emotions kind of some air, and then leaving yourself space to focus on other things that are important to you, the rest of the time. There are some CBT techniques that are worth exploring. I don't have time to kind of go through them today, but I'd be happy to compile some material, maybe again to disseminate to some of our viewers about maybe practical in the moment techniques to use when you have negative emotions that are starting to creep up, and some ideas on where to start. But those are just a few things kind of, coming off the cuff that I would recommend. Yeah.
Thank you. Dr. Myron, would you like to add anything?
Yeah, I agree with Ben. I think it's a huge transition to have that final, you're finished with treatment, and now you're asked with the big ask of going back to regular, quote unquote, regular life, knowing that things won't be the same as before you went through treatment. I think one analogy I've heard is that it's like going on the airport walking sidewalks suddenly to regular non-moving sidewalks. So from a moving sidewalk to just nothing, but it's more like running on that moving sidewalk and then suddenly having to stop. And that transition can be really hard. People deal with a lot of different emotions. They had the support of a team that they met with more often or frequently. They had a lot of check-ins to suddenly going to much more infrequent check-ins, infrequent scans. So it can be, it's very common for people to have either a fear of recurrence or a fear that the cancer is still there and just not being seen and somehow avoiding being detected by the scan. So I think that's a really common feeling. I would say that the oncologists, especially here at Dana-Farber, are very cautious and thoughtful in their approach to how often people should be getting scans. You know, if people should be getting, you know, if they're recommending every 2 month or every 4 month brain scans, that's probably even on the side of caution. You know, they wouldn't want people to be doing every week MRIs. I don't think anybody would want that anyway, but there's a lot of thought that goes into like how often those should be. And I don't think they're going on, you know, the wildly optimistic side. I think they usually err on the side of caution and coming in sooner. And I think, like Ben said too, it can be helpful just to name that fear, to voice either to your team or to your family, loved ones, your support system, that I worry that, you know, it's going to come back. I'm not sure what I'll do, and just talking it through, because when we're dealing with things like this alone or worries like this alone, it just our minds tend to spiral, or the worries kind of can take over.
I would piggyback on that real quick and just to, you know, say, let your medical team take some of the weight of that worry for you. It's hard to do that, and maybe it's easier said than done, but you know, sometimes when you worry, sometimes you get hit twice. Either you worry about the thing and then it doesn't happen, or you worry about the thing and then it does happen, and you're just kind of rewarded with like, see, I told you. You know, I think that there's an acceptance that whatever happens in the future, we don't always have control over that. So worrying about it won't change it. And I also appreciate that anxiety isn't a choice that people are making. People aren't making a choice to be anxious. And like I said, people are anxious because this is important. But like Dr. Myron said, I would say that your medical team is checking you at the right frequency that is right for you, and it's their job to be concerned about this for you. And so I would share the wealth of anxiety around recurrence. That's what I would say.
Thank you. Yeah, thank you both for emphasizing the importance of kind of airing it out, or giving, you know, honoring some of these feelings that are legitimate. I think I like that the idea of creating space to feel your emotions. Almost like, you know, people say you have to schedule time in the day for self-care. You maybe have to schedule time in the day to cry or to be anxious, you know, to really feel your feelings, because a lot of people, you know, you have to do other things in your day. You don't have the ability to really feel your feelings. And that can have repercussions, negative repercussions. So creating that space where you're just allowing yourself to feel, and maybe involving someone else, you know, to communicate how you're feeling too. I think, thank you for that advice. I think that's great advice. We've got a few more questions from the audience. So the first one is about books. Somebody is interested in hearing if the two of you have any book recommendations for patients and caregivers. I'm going to tell you that now and let you guys think on it kind of while we answer the other questions. If you don't have any books that come to mind, that's okay. But at the end, I'll loop back around with you guys. And I'll also mention a resource for books and a digital library that our patients have access to. So we'll loop back around to that, but I just wanted to put a little bug in your ear about books. Let's go to this question here about communication. So we talk a lot in our GROW group. GROW is a group that's for lower grade glioma patients. In our GROW group environment, about the anxiety of being identified by our friends and family as a patient first. Sometimes the person doesn't even realize they're projecting that type of image on me. Any tips on how to communicate gracefully to that individual that I'm a regular person and I'm not to be looked down upon or pitied? This is a really good question. It comes up a lot.
Kick them. Kick the person who's doing that to you. No. Yeah, it's so hard because treatment and this process can often take up such a loud part of your life that it can be hard for others to see past that to the thousand other things that make you you, right? And in some ways they're kind of acknowledging the struggle that you're going through and like naming the thing, the elephant in the room. But that does that does a disservice to everything else that you are to them, a friend or a partner or a family member. um you know I think it's okay depending on your comfort level, because I've talked to patients who want a little bit of both ways, where they want their friends to have sensitivity to the struggle that they're going through and everything they've been through, but they also want to be treated exactly the same way that they were treated, before this entered their lives. There's kind of a line to walk, and sometimes it's a hard one to find. People in our lives have very strong reactions to cancer in general based on their own experiences or anxieties around it. So sometimes there is some hand-holding, some educating from the patient about what's going to work best for them. Um, I think a gentle way is to it's kind of like the compliment sandwich thing, where you're like opening with, I so appreciate, what you do for me as a friend and supporting me through this journey. I would like, and then transitioning from there to, when we're spending time together, I want to really emphasize all the parts of me that are more than just a patient, or, I really value, I really want to focus on the things that are important to us as friends, not as patient and caregiver, but as, friend and friend or partners, et cetera. And then ending again with I'm just telling you this because you're such an important part of my care team, and I want you to stay a part of that. I think you can offer gentle criticism while still emphasizing the value that they have, and things that don't work well for you when like you have, like maybe you have enough reminders of um, this journey that you've been on, and you're not looking for others, and again, if all else fails, kick them. But other than that, I think that's a good place to start.
Thank you, Ben. Dr. Myron, we have a question here about SSRIs. So this is one of the treatment options that you mentioned earlier for depression and anxiety. I'm going to kind of paraphrase this question here, but sometimes, and correct me if I'm wrong, but sometimes patients will have will experience a side effect from an SSRI or a reaction to an SSRI where their symptoms actually get worse. And this person is wondering kind of how would you approach that situation with a patient who has that experience?
I think that's a great question. And I think it's always helpful when you're considering a new medication like an antidepressant or an SSRI specifically to talk through with the provider about what the symptom was or what the opposite effect or what the reaction you had was, because some medications are more likely to have certain side effects or certain reactions. So it's helpful to know, oh, you experience XYZ side effect from medication A. We know that medication A can cause those side effects, in this example, XYZ side effects. But we also have these other medications, either the same family, like another SSRI, or a different family of antidepressants that don't have that same side effect. They have their own side effects of their own, but not necessarily the ones that you experienced with the first medicine you tried. So it's always helpful to know what was the reaction that you had, as best as you can remember it. How long ago was it? What was the medication? Sometimes, it's hard to remember if it was 10, 20 years back, what was the medication, what exactly went wrong. But even just mentioning like, oh, I remember taking an antidepressant back in the day, like 10 years ago. I didn't like the way it made me feel. I don't remember why, but I just didn't sit with me. They might try a medicine in maybe a different class, or maybe a medicine, they might have a different approach. So antidepressants as a family, the SSRI specifically medication family, carry some similar risks across all medicines in the same category. So all SSRIs have some chance of causing nausea, GI symptoms tend to get better with time. But specific ones have their own specific side effects too. So if you had a reaction to one antidepressant, we might avoid that same medicine or other medicines that might cause a similar reaction too. So there are lots of different options. Unfortunately, no medication carries no risk, but when I talk with folks, it's usually thinking, let's weighing the risks and benefits, knowing that there's a chance you'll have side effects, but we also know you're suffering now when we want to find something that might be helpful for you. I always recommend also starting at a low dose and increasing slowly just to make sure that, you're catching side effects early before you're up to a high dose that's causing a lot more, side effects or distress.
Thank you, Dr. Meyer. And it's a good reminder that, like you mentioned earlier, there's a first line treatment and then there are other options typically. And even if the first line, one of those meds, let's say it's an SSRI, isn't working for you, perhaps another version of that or a different class, there are options is the point, which is hopefully reassuring to people in the audience. We have one last question here before we circle back about books. Just want to be careful on time, but this patient kind of mentions two different phenomenon. So one is when you have something, a tumor, a brain tumor that hasn't been biopsied or resected. So you don't actually know what exactly it is. I'm assuming there's just an MRI, that's being done on surveillance. So not having a definitive diagnosis, not being able to fit into a box. That's one kind of area that they're curious about. The other part of the question is about not being willing to talk about your diagnosis or your brain tumor. And maybe, I don't know if those two things you can relate them, but any thoughts on those topics?
Well, I will make an assumption that if you're part of this webinar, that means that even if you're not at a place where you are ready to talk about it yet, it sounds like you're at a place where you are ready to learn about it, and maybe you're looking at this more from a self-help kind of perspective. And that is completely valid. This is a personal journey for everybody. And, because it usually is a team effort among family and caregivers and all these other people, et cetera, I think it often turns what is a very personal experience into a public one, or at least an open secret, within the family, which, is done out of love and support, but which can also feel very strange for folks when they're navigating so many other challenges. I would say, I am biased in that I think that everybody can benefit from talking. And even if they're not in a place where they are ready to talk specifically about their diagnosis, maybe they want to talk about other things around it. And maybe that inevitably opens the door to talking about some of these anxieties that are kind of at the center, for you. That might be a gentle way, to kind of approach it. Let's get support around everything else. We'll table the scan, or the results that are ambiguous. We'll table that for later. But building trust with somebody who and rapport with someone like a therapist or a counselor, so that when you are ready to talk about it, I think that might be something to consider. I appreciate the frustration that you must feel when you do not have a specific box to fit yourself into in terms of what is this going to do to me. Will this have any impact on my functioning or my capacity? Will this, the mystery is almost worse than whatever the answer is. It's like that movie Jaws. Like, it's when you don't see the shark that it's the scariest. It's when you don't have all the information that your mind runs wild and goes to worst case scenarios, etc. I'm trying to pull out one or two more pearls of wisdom before I know we're almost out of time. But I guess I would just say I would repeat, like, let your medical team do the worrying for you. And I would push you to open yourself up to talking with somebody, even if it's not about this, just talking to somebody about other things, everything and anything that's going on with you, and establishing that relationship and building that relationship with a provider until you're ready to, explore more further. Because I think I don't want to say that it's inevitable that you want to explore it further, but I think there's a pretty good chance that you will.
Thank you, Ben. Thank you so much, Ben and Dr. Myron. This has been wonderful. I'm so glad that we could bring this topic on here and have the two of you join us on a Now webinar. Because we are at time, I'm going to put some book recommendations that Dr. Myron has generously provided into the chat. And, Ben, if you think of something, you're more than welcome to add them. You can send them directly to me and I'll add them into the chat. And then everybody, there is a fabulous resource that the Blum Center generously offers all patients, which is access to the digital library, the digital overdrive, through a library card, a free library card. So Sierra here is going to put a link for getting access, for getting a library card into the chat. And she's also going to put a slide up with a QR code. So this is just, if you're interested in searching for these book recommendations in their library, you're welcome to. We may also find something else. We thought it was just a good opportunity to share this resource with everybody. And thank you everyone so much for joining. We'll be starting our end of webinar poll soon. So please do take a moment to fill that out before signing off. And we hope to see you in the fall. We'll be taking a summer hiatus with the Now webinars, but we'll be running back up again in September for a discussion on brain health and preservation of cognitive function. If you want to keep up with our webinars and our programming, please do bookmark our website. I'm also going to put that in the chat and you can sign up for emails if you don't already get them. Thanks again, everybody. And Dr. Myron and Benjamin, thank you so much.
Thanks for coordinating.
Yes,
Thanks for
thank
having
you.
us.
Thank you both again for joining us. Thank you to Rachel as well. That was a great presentation and very important. So thanks for taking the time to work with us on that. As a reminder, this was recorded and it will be posted on our Blum YouTube playlist as well.
Thanks, everyone.
Thank you.